All right. Well, again, thank you everyone for being here today. My name is Kayla Snyder. I am the SNAP and Seniors Professional Network Coordinator here at Hunger Solutions New York. Today, we're going to talk about SNAP medical deductions. Helping me today are my colleagues, Jen and Emily. They are on the tech side of stuff. And then also, answering some questions that will come up are my colleagues, Dawn and Connie. So as I said earlier, feel free to place your questions in the chat, and Dawn will be answering some questions in the chat. And then we should also have some time at the end for additional questions. So for those of you who don't know, Hunger Solutions New York is a statewide anti-hunger organization. We increase awareness of, support for, and participation in federal nutrition assistance programs, including SNAP, WIC, the Summer Food Service Program, and more. On our agenda today, I will briefly review some SNAP updates. We'll get into some medical deductions. We'll review some resources, and then we'll have time left for questions. This Lunch and Learn is really sort of building upon our previous Lunch and Learns. So if you're not familiar with the specific SNAP rules for seniors, you can find all those rules and more resources at our webpage, snapandseniorsny.org. So let's jump into SNAP October 1st changes. So every year, USDA updates some SNAP guidelines. This year, there were some updated income guidelines. They've increased from last year. I'll have a chart on the next slide that we can look at. There are also some changes in shelter deductions, as well as the standard deductions and utility allowances that the SNAP offices use when determining budgets. So those are all listed in our toolkit for you. This slide deck will be shared with you all, and so you'll be able to click through all of these resources and get all of that up-to-date information. For seniors who don't qualify for SNAP through categorical eligibility, they may still be eligible for SNAP. And in that event, they will need to pass their net income test and a resource limit. So for seniors that might qualify that way, there is an updated resource limit as well. And now currently the minimum benefit for folks is $23. So that is up $1 or $2 from last year as well. This is the updated poverty guidelines chart. So for seniors, we are looking at that 200% of poverty. So a senior can be eligible for SNAP. A senior that lives alone can have as much as $2,265 in income a month and still be eligible for SNAP. Again, it's that 200% that we want to pay attention to for seniors. This is categorical eligibility. So again, if seniors qualify for SNAP under these income guidelines, there's no resource test for them. I also wanted to remind folks that folks can't be denied SNAP benefits because they own their own home or car. SNAP guidelines change at least once a year. So I always want to encourage folks, if you come across folks who are hesitant or reluctant to apply for SNAP because maybe they've been denied in the past, remind them that these guidelines are often updated and they could be eligible for SNAP. Again, all of these rules will be on our SNAP and Seniors webpage. I also wanted to talk to you guys all about EBT skimming. It's come to our attention that EBT skimming and text phishing scams have been on the rise. Law enforcement and SNAP administrators are aware that this is happening. Unfortunately, counties cannot replace stolen benefits at this time. But if this is happening in your county, we want to hear from you. So feel free to send me an email, talk in the chat. If skimming is happening or you're seeing it more often in your county, let us know in the chat, send me an email. These card skimming scams are especially hard to detect. So typically people's benefits through skimming will be stolen when they go to purchase their groceries at the checkout line at the grocery store. These scammers are using a physical device that sits over a retailer's card reader. And through Bluetooth technology, these scammers are able to get EBT card information. And unfortunately, there are thousands of cases in New York that this has happened to folks. And once thieves get the EBT information, they have access to folks' EBT accounts. So if you're coming across folks who are, involved in these unfortunate skimming events, we want you to encourage them to report their stolen or skimmed cards as soon as possible. So they can report them to the EBT customer service helpline, which is listed on this slide, or they can report it through connectebt.com or the Connect EBT mobile app as well. We do also have a dedicated web page about EBT skimming with some more information on there and some best practices about keeping EBT cards safe. So again, if you're coming across folks who their cards have been skimmed, make sure that they're reporting their stolen or skimmed cards immediately and protecting their PIN and doing what they can to keep their cards safe. Hopefully in the future, there will be ways that folks can get replacements for these missing benefits as well. But like I said, unfortunately, counties are not able to replace stolen benefits at this time. Next slide. So very quickly, in order to apply for SNAP, folks can do it in a couple of different ways. They can do it in person at their local DSS or HRA office if they live in New York City. They can also print an application from the internet and mail it into their local SNAP office. They can also call their local SNAP office and request one be mailed to them, fill it out and return it. But as always, the quickest and most effective way to apply for SNAPs is through mybenefits.ny.gov. If folks are on Long Island or in the rest of the state. If you are in New York City, Access HRA is going to be the best way to do that. A quick note about mybenefits.ny.gov. We are looking for feedback from those of you who are application assisters. Recently, there was a system change. And so in order for folks to apply for SNAP through mybenefits.ny.gov, they have to create an ny.gov ID. And in order to create an ID, you also must have access to an email account. And so, we know that technology is sometimes a barrier for folks. So we'll put together a survey to sort of ask you questions about some of the barriers that folks might be experiencing when applying for SNAP benefits online. This survey will also be in an email follow-up to everyone as well. And someone also mentioned that clients can also contact their local NOEP coordinator as well. Yes, local NOEP coordinators are there to help folks as well. We will review more about NOEP in the coming slides. So currently in effect is a public health emergency. The public health emergency has been in place since March of 2020, since the COVID-19 pandemic began. The public health emergency is renewed on a 3-month basis. So the current public health declaration will run through January 11th, 2023. Now we didn't have any notice back in November about the public health emergency not being extended. So we do have reason to believe that this will continue into the new year, into April. We should be, if they're planning on not renewing the public health emergency, we should be given a 60-day notice to help prepare. So as long as the public health emergency is in place, households will continue to receive those emergency allotments that they've been receiving since March. And just to also remind folks, Emergency allotments will be awarded to folks separately from their regular benefit. So folks might get their regular SNAP benefit in the beginning of the month, and then their emergency allotment benefit will be awarded to them later in the month. If you know someone who is getting SNAP benefits and they haven't been receiving those emergency allotments, definitely encourage them to connect with their local NOEP coordinator. So hopefully, we can figure out what's going on with that. Once the public health emergency ends, thanks, Emily, emergency allotments will continue for 1 month. So for example, if the public health emergency ends in April, emergency allotments will be awarded for May, but then no longer. We will keep everything up to date on our Hunger Solutions New York COVID-19 webpage as well. All right, so now we will jump into medical deductions. So what are medical deductions? Medical deductions are a way that SNAP folks who are senior or disabled may be able to maximize their SNAP budget. They're very underutilized in New York State, with only about 19% of folks utilizing them. So the Center on Budget and Policy Priorities reports that individuals who claim anywhere from $50 to $200 in medical expenses can get an increase in SNAP benefits anywhere from $7 to $69. So reporting these out-of-pocket medical expenses can really help boost that SNAP benefit payment. Don just put in the chat too, the emergency allotment brings folks to the maximum benefit amount for their household size. So the medical deduction hasn't really been utilized over the past 2 years. But once that public health emergency goes away and folks aren't receiving that extra emergency allotment, we really want folks to take some time to review their potential deductions to ensure that they're really maximizing that budget. So the medical deduction can only be utilized by folks who are 60 or up, so seniors under SNAP rules, or folks who are disabled. Under SNAP rules, in order to qualify as a disabled individual, the individual needs to be receiving a federally related disability benefit, such as SSI, SSD, disability-related Medicaid, or a veteran's disability benefit. Next slide. So what qualifies as a medical expense? It needs to be an out-of-pocket medical expense. So this can be anything from health insurance premiums for private health insurance, Medicaid or Medicare. It can also include Medicaid spend downs. It can include medication, including prescription and over-the-counter medication, other medical needs such as mental health care, home health care, or pet care for service animals. And it can also include out-of-pocket medical expenses for medical supplies or equipment such as eyeglasses, dentures, or prosthetics. This is not an exhaustive list of qualifying items. We have more items that are listed on our medical deduction worksheet, which I can link for you all here, but you should be able to, link it in the, it's not letting me paste, so there it goes. So you should be able to review the medical deduction worksheet here and review some other out-of-pocket medical expenses that can qualify. Unfortunately, the cost of a medically necessary or special medical diet are not deductible. So an individual can calculate their medical deduction by determining their monthly out-of-pocket medical expenses, right? So folks who are application assisters, you'll want to help folks identify where they might be spending money out of their pocket on their medical supplies each month. So like I said, that includes prescriptions, maybe it's healthcare premiums, it could be a large bill that they owe a healthcare entity. The SNAP office will then utilize that information so that calculated medical deduction that they come up with, they will utilize that to help determine the SNAP budget. As I said earlier, medical deductions haven't really been considered over the last few years because the public health emergency has been in place. So everyone has been getting that maximum for their household size. But again, that emergency allotment will phase out eventually. And when it ends, be sure to remind folks that if they are disabled or seniors, that they could be eligible for more SNAP benefits if they have a lot of out-of-pocket medical expenses. Some best practices for documentation for medical expenses. You want to make sure folks are saving their medical bills and receipts. I know I tend to throw my receipt from the pharmacy away when I go there every month. But if you know someone has, they're paying a lot of money for their medications each month, be sure that they're hanging on to that receipt or any other medical bill receipts that they may have. Whether that's co-pays or they got a new pair of glasses this year that they had to pay for. Make sure they're hanging on to those receipts. You also want to, when folks are applying for SNAP or recertifying for SNAP and they're submitting this verification documentation, you want to make sure they're submitting the copies only of it. You don't ever want to submit the only copy you have of something. You want to make sure you retain a copy for your records as well. And so, like I said, have folks save their medical bills and receipts, submit the copies only, and submit these documents during either the application period or during recertification time. And then keep in mind too that household recertification period is going to be different depending on their eligibility criteria. For folks who fall under ESAP, their recertifications are going to take place every 36 months. For folks who qualify for SNAP through NICECAP, they're going to need to report their medical expenses on their case information collection sheet. And then folks who qualify for SNAP through sort of regular SNAP rules, their recertification period is going to take place every 12 months. John also mentioned in the chat that if folks are like me and they throw away their pharmacy receipt, they can ask for a printout from their pharmacy for all their prescriptions over the last month or 6 months, or even I'm sure they can go back a year. Someone also mentioned that I know transportation to and from medical appointments is also considered for deductions. How do you prove that? That might be a good question for Connie at the end. If John doesn't get around to answering that in the chat, we can review it again at the end. And if we don't have time, we'll make sure we get that information over to you. So again, for medical deductions, some expenses are already calculated at that monthly amount, right? Like prescriptions, monthly medication costs, right? If someone does have a large bill, they might be able to claim it for that specific certification period. So if someone has, for instance, a bill for $1,500 for a medical device, the SNAP office can either average that through their recertification period, or they might be able to elect to take a one-time deduction. It's going to depend on what is most beneficial to that client. So Dawn put in the chat too about proving transportation. You can use a Google map and show the mileage each way for each medical appointment. OTDA uses the IRS medical reimbursement rate. So if you're looking to prove transportation to report for out-of-pocket medical expenses, plug in your start location and your end location in Google Maps and keep that handy. Sorry, Emily, can you go back to the last slide? So just to recap really quickly, when someone goes and applies for SNAP, the SNAP office should be screening them for any out-of-pocket medical expenses that they may have. And they, either the SNAP office or if they've connected with a NOEP coordinator, if they've determined that maybe they have out-of-pocket medical expenses that total more than $35, they're going to use that total that they found and factor that into the SNAP budget. And so that total being factored into the SNAP budget could potentially increase the amount of SNAP benefits that particular individual might get. Someone mentioned earlier our NOEP program. Hunger Solutions New York manages the Nutrition Outreach and Education Program. So the NOEP program offers free and confidential services to connect New Yorkers with SNAP. They can also provide referrals to other nutrition assistance programs such as WIC. If you don't know who your local NOEP coordinator is, you can look up their contact information by visiting foodhelpny.org. You can either type in your zip code or select your county from the drop-down menu, and it will populate your NOEP coordinator contact info. If you live in New York City or Long Island and you're looking to locate your NOEP coordinator that way, you'll just have to toggle to the different map. I believe the website defaults to the rest of New York State. So the next slide talks a little bit more about some of the services that NOEP coordinators can offer folks. Aside from helping people with their SNAP applications and recertifications, they can help an individual communicate with their local SNAP office about, maybe their application was denied and folks aren't sure why it was denied. It could have been wrongfully denied. So they can really help resolve some of those barriers related to SNAP participation. They can also help with translation services. They can do home visits to help people apply for SNAP benefits, as well as other in-person visits, whether they're meeting in the community. And they can also help people apply for SNAP virtually, whether that's over the phone or through email. And if folks are maybe not sure if they're eligible for SNAP benefits, they can connect with their NOEP coordinator, and the NOEP coordinator can pre-screen for eligibility to figure out if maybe that person might be eligible for SNAP. So again, to find your local NOEP coordinator, you're going to want to visit foodhelpny.org. And lastly, for all of you, I have a resource slide. So the SNAP and Seniors Professional Network has a dedicated webpage. It's snapandseniorsny.org. And on there, you can find all of the SNAP specific rules for seniors, including the medical deduction, as well as that medical deduction worksheet that I was talking about earlier. It will provide you some more information about what can be deducted for medical deductions, as well as give you a little opportunity to sort of calculate a medical deduction for someone. We also have additional outreach resources on our webpage, including flyers and social media language if you're looking to do some outreach. And then also very handy is our Pathways to SNAP chart, which outlines a couple of different ways that seniors might be eligible for SNAP. So that is available on our snapandseniorsny.org website. On our agency website, hungersolutionsny.org, if you are folks who are helping people apply for SNAP, we have an eligibility pre-screening guide that is available as a resource to you all. We also have a benefits estimator tool where you can plug in some information and get an estimated benefit amount. mybenefits.ny.gov is how folks in upstate New York are going to apply for SNAP, but they also offer a pre-screening tool too. Folks can pre-screen for SNAP eligibility as well as HEAP and some other resources on there as well. And then I also have linked for you all an OTDA medical expense brochure that just outlines a little bit more information about the medical expense, as well as the OTDA hotline. If folks maybe have questions about their about SNAP, they can contact them as well. So to very quickly recap, the medical deduction has not been it's underutilized in New York State, but it hasn't necessarily been utilized over the last couple of years because that public health emergency has been in effect, and folks are getting that emergency allotment. So they're getting the maximum amount for their household size. When the public health emergency ends and emergency allotments go away, it's going to be really important to make sure folks are aware of what out-of-pocket medical expenses they have, and they're reporting that to their SNAP office, because it's going to, a lot of people are going to go from getting the maximum SNAP benefit to getting the minimum. If they have a lot of out-of-pocket medical expenses, we want to make sure that the SNAP office is aware of that and taking those into consideration when they're calculating their budget. So we are also always here as a resource for you. I can put when I send a follow-up email, everyone's information will be in there. You can also find everyone's information on our webpage, hungersolutionsny.org. If you have any questions, definitely reach out. So that is all I have for you today as far as information goes. I'm seeing Dawn is answering some questions in the chat about receipts. If anyone else has any questions that they want to ask live, you can feel free to unmute yourself and ask, or if not, continue to place them in the chat. This particular person who was asking a question about transportation earlier, John had mentioned that you can use Google Maps to help show transportation miles to maybe get reimbursed for that. She had also mentioned that the pharmacy can give individuals a printout of their yearly or monthly costs for prescriptions. And the medical deduction worksheet has information on what documentation can be used to prove each item that can be deducted as well. So definitely utilize that medical deduction worksheet. I'm going to link it for you all right here. So there's the medical deduction worksheet right in the chat if you wanted to look at that quick. Someone said you can't unmute yourself, you have to raise your hand instead. Okay, so if anyone has a question, please raise your hand. And if you want to ask it live, you are more than welcome to. If not, you can place it in the chat. All right, I don't see any raised hands. Jen just updated and said everyone should be able to unmute themselves now. But I don't see any raised hands. Oh,
hi, good morning. I'm so sorry.
That's okay.
I'm like not able to find where I can raise my hands.
That's all right.
A long time. So I am Lady. I'm the SNAP coordinator in Rockland County. Thank you so much for this very informative meeting. My question is, I've only been a SNAP coordinator for less than a year, so
okay.
I apologize if my question should be self-answered. But
no.
If I have a senior who is currently working, whose budget or whose income is a little bit above the guideline for poverty, but has enough medical deductions to get her under the guideline, does that count, or is it only for seniors who already income meets the guidelines?
So, and Connie or John?
I'll help with this. So,
fabulous.
So when a senior is categorically eligible, we have to do a gross income test at the top. But I think, Lidi, what you are saying is that you have a senior who is over 200%. Is that true?
That is correct.
Okay, so when we have, and this only happens with senior or disabled people, if you have a senior that's over 200%, you can go back to doing it the old budgeting way prior to categorical eligibility. And that means that you don't do a gross income test. And that's why medical deductions would impact that, because you're able to deduct everything and do that net income test. But you do have to test resources when you go back to going through the old way. So that's the only time medical deductions will impact eligibility, because under categorical eligibility, everyone has to have a gross income test. So if you, unless someone is in the situation in this case where they are above the gross income test, but as Leedy said, as an application assister, you see that they have enough deductions, and that could be shelter, certainly medical deductions help, and that gets them below that 100% of poverty, which is the net income that we would have to do the test at. So hopefully that helps answer that question.
Yes, thank you so much.
Awesome. The medical deduction questions, especially since they haven't been utilized in a while, I think, they're not at the top of our mind. So definitely, if anyone has any questions after this, feel free to reach out. Like I said, we're here for you. We're a resource for you. And I also just wanted to remind folks, if skimming and scamming is happening more frequently in your county, or just started happening, we also want to hear from you on that as well. Again, everything will be sent out to you, the recording, the slides, some questions and answers that we've chatted about today, as well as all of the resources that we put together for you all. So with that being said, I will let the rest of you get back to your very busy activities, and thank you again for taking some time to join us today.